Good afternoon. We are here today to discuss where Washington County stands with the fight against COVID-19. Today, you will hear an update from local health officials and community leaders. As we continue this fight, please be mindful to wash your hands, wear a face covering when out in public, avoid large gatherings, and social distance. It is up to us to stop the spread in our community. Thank you for your steadfast commitment over the past 7 months and for putting the health and safety of those most vulnerable at the forefront of this fight. Let's continue to work together to stop the spread in Washington County. Now I would like to welcome Washington County Health Officer Earl Stoner to the podium. Thank you.
Thank you, Commissioner Klein. Good afternoon, everyone. As we enter the 10th month since the U.S. first reported cases of COVID-19, the country has seen more than 8 million confirmed cases and approximately 220,000 deaths. Washington County saw its first confirmed case on March 21st. Since then, cumulative confirmed cases in the county have risen to 2,083 and sadly 42 deaths. Overall, the age groups with the most cases in Washington County are 20 to 29, 17%, 30 to 39, also at 17%, and 50 to 59, again at 17%. Combined together, these age groups account for 51% of the total cases in Washington County. The distribution regarding gender is 53% male and 47% female. Washington County's response to this public health emergency continues to be coordinated through the Emergency Operations Center. The EOC continues to work in close collaboration and coordination with the Maryland Department of Health, Maryland Emergency Management Agency, Meritus Health, and other federal, state, and local partners. We are in a very different position than we were in March. The EOC and associated partner agencies and organizations have built out and expanded critical focus areas since the start of this pandemic, all of which strengthen the county's ability and capacity to respond and ensure our community as safe as possible. These focal areas include, first and foremost, testing. Capacity to test has grown into a robust network. Meritus Medical Center administers the vast majority of tests here in Washington County, while the health department provides supplemental testing through drive-through and mobile locations. These mobile sites provide access to areas that are geographically challenged and to individuals who are historically marginalized. Since June, these mobile sites have administered 1,417 tests, and the drive-through site has administered 638 tests. Next critical area, contact tracing. At the start of the pandemic, the health department quickly established a contact tracing unit to identify confirmed cases and at-risk contacts and to quickly get them into isolation. This activity aims to break the cycle of viral transmission and slow the disease spread. Currently, 25 workers maintain regular contact with and support for individuals who are in isolation. In addition to the 2,083 confirmed cases, another 2,200 identified contacts have been in this program. However, there's always a however. Recent trends, unfortunately, show us that a significant portion, upwards of a third of individuals, of the people who are contacted as a confirmed case or a contact are not cooperating fully with contact tracing efforts. If we are to maintain the lowest amount of viral spread possible in Washington County, it is imperative that people cooperate with the tracing program by providing information regarding their contacts and then isolating themselves until they are fully released. The third area of focus is hospital surge readiness. Meritus Medical Center has in place a comprehensive plan for medical evaluation and care should the need exceed the limits of normal capacity. This includes the newly opened Regional Infectious Containment Unit, which is a 20-bed negative pressure and ventilator-capable unit. Next area of focus has been PPE. personal protective equipment in the stockpile located and managed by the Emergency Operations Center. In the early days of the pandemic, the global supply chain struggled to keep up with demand and to deliver critical protective equipment. The EOC aggressively pursued needed supplies through private purchases and through the state of Maryland down from the federal strategic national stockpile. Additionally, donations were received from several businesses and organizations which were truly appreciated. To date, the EOC has distributed over 192,000 pieces of PPE to first responders and other community organizations. The next critical area of focus has been public awareness. The Joint Information Center continues to coordinate timely and accurate information to the media and to the public. A highlight of this is the This is a Hero mask campaign, which I would hope at this point in time everyone is familiar with. It is a media campaign, public relations campaign that was focused on raising awareness as to masking and wearing masks appropriately. Billboards, advertisements, and the like have been throughout the Washington County regarding that. Next, economic recovery through recovery support function number 2. Our local business owners and their employees are an essential part of our community. Recognizing the significant negative impact this pandemic has had on our local business community, the county acted quickly to provide funds out of its county CARES funding. The highlight of this effort is seen in the collaboration with the City of Hagerstown on the Rise Up Business Stabilization Grant Program, which was established to assist small businesses that experienced financial loss caused by the pandemic. Another critical area is vaccine planning. Earlier today, Governor Hogan announced that Maryland's initial draft mass vaccination plan was submitted to the CDC. Although we don't have full details on this, using this framework, we here at the local level have begun the process of working with the state and its affiliated federal and state agencies to establish local strategies to ensure vaccination administration to those here in Washington County who wish to be vaccinated once the vaccine becomes available. These efforts and the efforts of the community as a whole flattened our curve and have continued to position us well. However, there's the however again, the transmission of COVID-19 remains a significant threat to the health and safety of every resident of Washington County. Moving into the fall and winter months, we are very concerned about the potential for a significant resurgence of the virus. People will begin to move their activities indoors, and that's where we know the virus spreads fairly easily. Cases and hospitalizations around the country are rising significantly, especially in the West and Midwest. Maryland, unfortunately, is not immune to this. It is beginning to see once stable COVID-19 related metrics rise in some areas, and locally, we have taken notice to upticks in our key indicators that we monitor. As expected, our new infections have continued to rise, but unfortunately, and most concerning, we have recently experienced a few significant spikes. If you look at the total number of cases per month throughout the pandemic for Washington County, in March we had 19. Remember, we didn't get our first case until the 21st of that month. April, we had 193. May, 248. June, 208. July, 276. August, 351. And in September, 501. Our positivity rate, which again is the percentage of specimens of those individuals being tested that come back positive, has also spiked several times over recent weeks and remains unstable. Positivity for Washington County was 1.2% in early August. That was the lowest that we had reached during the pandemic. It rose to 2.9% by late August before declining slightly. Since then, we've experienced fluctuation in this critical indicator with a recent peak of 4.4 in late September before a decline brought us to 2.1 as of today. Our case rate, which is the 7-day average of new cases, has spiked on several occasions also. It currently is the 9th highest in Maryland at 10.9. And again, to take a deeper dive into this, on August 31st, our number was 7. So on average, 7 new cases a day. The 21st of September, we had risen to 14.5. October 5th, we had gone back down to 8.2. And today, we are at 10.9, and over recent days, that number has continued to rise. Additionally, we are experiencing more COVID-19 hospitalizations than previously. Throughout the summer and in recent weeks, we have experienced numerous outbreaks and clusters. The biggest factor related to new cases locally has been and continues to be gatherings. I have great concern about this. Small gatherings, large gatherings, weddings, birthday parties, funerals, you name it, we've seen it. Through our contact tracing efforts, people report what activities they have engaged in for the 2 weeks prior to their positive test. For Washington County since July, the highest reported activities attended are family gatherings, outdoor events, and religious services. Each of those being reported at upwards of a quarter or around 25% of people reporting that they had attended one of those areas. Just within the past week, the highest reported activities attended were family gatherings, religious services, and weddings. People are very comfortable becoming relaxed when they're attending gatherings hosted by friends and family. It's only natural. They're more likely to remove their mask, and they're more likely to not adhere to distancing because they are in close proximity and in casual conversation with someone who's a friend of theirs or who is even a family member. These are the things that we have to keep in mind when we are thinking about hosting social events and gatherings and attending social events and gatherings. I recognize that social and emotional well-being is critically important during this time. But I want us to also recognize the importance of distancing and wearing masks anytime, indoors or outdoors, we are with someone who is outside of our household, even if they may be related to you. As we continue to navigate the pandemic and adjust to our new normal, we must remain vigilant and continue taking the necessary preventive measures we all need to take to keep our economy open and moving forward, to be able to visit our loved ones in nursing homes, and to bring some sense of normalcy back to our lives. This means we must respect the virus and take this threat seriously, knowing that it poses a significant risk to keeping Washington County safe and open. It certainly doesn't mean we have to be afraid. However, it does mean that we have to be realistic and practical about it. What we do matters, and if we follow what we know works, the next few months can be very different than what is projected. The good news, there's some good news here, is that there are a few very simple things that each of us can do that will drastically slow the spread of the virus and keep our community as safe as possible. First and foremost, wear a face covering. Scientific evidence continues to show that wearing a face covering reduces transmission of the virus. This is the most important tool we have at our disposal. Also, even if you wear a face mask, a face covering, whatever you may want to call it, please, please, please wear it correctly. It must cover both your nose and your mouth to be effective. You expel droplets, you expel aerosols evenly, just as equally, out of your mouth as you do out of your nose. Second, maintain physical distance. This is also critical to slowing the spread of the virus, and coupled with masking, these are the most effective ways to slow the spread. The recommended distance is 6 feet between you and people you don't live with. And additionally, since the CDC now recognizes the virus can spread further through aerosolized particles, the more distance the better. Third, avoid crowds. Crowds in large gatherings can quickly become super spreader events, especially when people aren't taking basic precautions like masking and distancing. Fourth, don't spend time indoors with people you don't live with. Scientific evidence shows the virus spreads easier in enclosed spaces where ventilation is limited and distancing is a challenge. This evidence shows the spread of the virus is up to 18 times higher indoors than that of outdoors. Lastly, wash your hands well and often. Wash for at least 20 seconds. Wash after every trip to the bathroom, blowing your nose, coughing, sneezing, before eating. If soap and water aren't available, use hand sanitizer that contains at least 70% alcohol. These 5 things are critical in eliminating and reducing the spread of the virus. And all of us can do it. Additionally, it's critical that everyone get a flu shot, especially this year. Each year, influenza causes a significant number of hospitalizations and deaths, and we are concerned about its impact on hospital capacity if we experience a surge here in Washington County. The holiday season is also fast approaching, and with it, many questions on how to celebrate and how to celebrate safely. The CDC has issued guidelines on how to celebrate the holidays, breaking down recommendations for the safest way to partake based on low, moderate, and high-risk activities. The recommendations focus on keeping gatherings small. If everyone lives in the same household, there isn't much of an added risk. However, that risk increases when you have extended family or people not in your regular household circle that you're interacting with. Please visit www.cdc.gov for the full guidelines. I also want to make clear that even during the pandemic, we in public health are obviously focused on the task at hand, but we are acutely aware that other pressing health issues haven't gone away and in some cases, unfortunately, have worsened. During this difficult time, we have all struggled to some degree, some more than others. However, people with behavioral health issues may have a more difficult time than usual, and people without underlying behavioral health conditions might find themselves struggling with depression, anxiety, substance abuse, alcohol, or even just the ongoing isolation and disconnection from family, friends, and social activities. It is important right now to notice when someone you care about might be having trouble and in need of some help. What it really comes down to in these situations is if you notice someone struggling, the simple act of saying, "I notice you seem like you're having a hard time. Is everything okay?" may be the difference in saving someone's life. If you or someone you care about needs help, call 211 and press 1 to receive assistance. Pandemic fatigue is real. The frustration is understandable. But we're at a critical point in the fight. We have to remain vigilant, and we have to stay on top of this. Until we have an effective vaccine and expanded treatments, wearing a face covering and distancing is the best tools that we have. This is a good time for each of us, everyone in the community, to ask ourselves what we can do to try to limit the spread of the virus and to keep the community, our neighbors, our friends, our family as safe as possible. In closing, I would like to thank the dedicated professionals that are working on this for their tireless work responding to the crisis. Additionally, I would like to thank everyone in the community for their cooperation and for doing your part in keeping your family and community as safe as possible. We really need to double down. Now's the time that we need to double down with the fundamental public health measures that we all talk about every single day, because they truly do matter. Wear a face covering, watch your distance, and wash your hands. Thank you. Now I would like to introduce Dr. George from Meredith Medical Center.
Well, good afternoon. I'm Dr. Aaron George. I'm a family physician and the Associate Chief Medical Officer at Meredith Health. And I have to emphasize, when I talk to my patients as a family doctor, I continue to hear a little bit of concern that as we move forward, and we're 6 and 7 months into this, should I keep wearing a mask? I haven't gotten sick yet. And the answer, without question, is yes. I want you to consider the same reason that you get in a car and put on a seatbelt. And it's not because you haven't been in an accident in the last 6 months, so you don't have to wear one today. We really need to continue wearing masks because they protect us, they protect our loved ones, and they decrease spread in our community. So I really want to urge the importance of continuing to wear masks appropriately, washing our hands, and really watching our distance. You can think of this as the 3 W's. Wash your hands, wear a mask, and watch your distance. If you do this every day, there are 3 simple things that can help keep our community much, much healthier. And as a family physician, allow me to focus on a lot of the other issues that we all know are impacting our families, the mental health issues, substance abuse, and others that we're starting to see creep up as we're all becoming just a little bit fatigued with this virus. Now, one of the challenges is that as we enter flu season, all those typical coughs and colds and sore throats that we see every year could be a little bit confusing this year because the typical flu, the typical common cold, tends to mimic some of the same symptoms that we see with coronavirus. And this can be scary, it can be concerning. And so at Meritus Health, we set up a number of different options for our community so that we have places for everyone to go if they're not sure where to turn. We continue to have a 24/7 COVID support line. So if you have that question about where do I go or what do I do, you can reach out to our team. We do worry about the thought of, if I have a little cough or cold, should I go into work? And the answer is, you should first be evaluated or touch base with your primary care provider. And to help expand access in a safe way, we have set up 3 separate centers around town. And these are areas that we're calling seasonal illness care clinics. So the term we're using is the sick clinic. It's a temporary clinic just for the season to do just that. It's to stand up for those seasonal illnesses that we're not sure. Is it common cold? Is it a cough? Is it strep throat? Where you as a patient 7 days a week can present and have a doctor safely evaluate you and help you to understand what could be going on for you or your family member. Now, the first of these is at our Creighton Boulevard site. That's 13620 Creighton Boulevard. It's our Meritus Medical Plaza North. And you can show up there 7 days a week to be evaluated. We additionally are setting up seasonal illness care clinics in Smithsburg and then also on our Robinwood campus as well, because we want to provide plenty of opportunities for anyone wherever they are in our community. Now, this does beg the question, and my patients ask me this almost every day, should I get my flu shot this year? And again, the answer, absolutely yes. Please get your flu shot any way possible, whether it's with your primary care doctor, your local pharmacy, anywhere that you can get a flu shot. We feel comfortable that every single flu shot limits the number of flu that we're going to see in the community, and it's going to decrease the overall mortality or death rate that we see as well. So please get your flu shots because it will help eliminate that second virus so that when we do see symptoms, we'll have a little bit better chance of understanding what they truly could be. And lastly, because we want our community members and everyone in our family and our friends and our team members to know if they have COVID or not, we do continue to have daily screening at our Meritus Medical Plaza North, and you can show up 7 days a week to have a COVID test and help to identify if you or one of your loved ones has this and help to prevent the spread ultimately. Thank you.
Good afternoon. I'm Jordy Newman. I'm the president and CEO of the Washington County Community Action Council. It's our mission at CAC to help our clients be self-sufficient. COVID is no different, although it has certainly brought some new challenges for us. We knew it was going to be a problem for our normal clients, but we are seeing a significant increase in households we have never served before. As the economy suffered, so did the employment in our community, and as a result, several households were not able to make their payments for their rent or their mortgage or fell behind on their utilities. CAC took a very proactive approach with this. we reached out to our partners on the state level with the Department of Housing and Community Development to secure supplemental grants to what we typically apply for each year. We also reached out to HUD to gain some federal dollars as well. And all of this funding is based on the essentials of housing and food and utilities for our clients. I know there are a lot of other needs in the community, but our grants are very specific to what we can assist with. Unfortunately, we can't help everyone. We do have guidelines that you can find on our website, and I can go into those in a little bit. But I just encourage you to come down and see what we can do for assistance. We have several different funding sources. They all have different guidelines. They all have different dates of when that money needs to be expended. So allow us to do our job and come down and let us look at your particular situation and how we can assist. As I mentioned, our grants are very specific to the causes they assist with. Public utilities, meaning the City of Hagerstown's electric, as well as Williamsport's electric, cannot be helped with the county grant, the county cares funding that we received, nor with the city CDBG money. And that's a federal rule that has nothing to do with local administration making things difficult. It's basically the federal government doesn't want municipalities to recoup lost revenue through these grants. It's challenging for us because it's eliminating the exact clientele that they're intended to serve. However, we did secure an ESG grant through the state to assist with those particular bills. That grant was for $110,000, and to date we have spent $35,470 of that, and we've served 23 households and 93 individuals with that particular grant. The good news is we were notified last week that there is a second round of that ESG COVID grant, creatively ESG CV2, and that will be $920,000 coming into the community. However, that grant does have restrictions. Half of that money has to be spent on rapid rehousing, which is a practice of taking literally homeless families and placing them into sustainable housing. So although that dollar figure sounds fantastic, it does have restrictions, and that will create some challenges for us. Our energy department has been very active. That fiscal year started in July, and as of yesterday, we have processed 2,811 applications. In a normal year, we do about 4,200, so that is up substantially. Right now, we are leading the state in processing time. 99% of the applications are processed in 9 days or less, and we've distributed more funding to clients than Baltimore City or Baltimore County. So that's a little bit to tell you the need, unfortunately. Utilities technically can be terminated on November 15th. That will require a signed affidavit from a judge because it's during the cold weather season. However, the city and the private providers, First Energy, are required to do payment plans with clients or customers. You have a 12-month payment plan, no money down. You just have to call and set that up. If you apply for energy through the OPEP program through CAC, which is a state program, you will have 24 months to make your payments. As well, if you've never utilized that service, there is an arrears program that could take care of a large amount of what you owe. So again, I encourage you to come in and let us figure that out. All this information can be found on our website, which is very simply wccac.org. And there are tabs for the COVID documents that'll be needed. When you do apply, again, our grantors have requirements that are beyond our control, but it's documentation that we have to have. We are audited annually by the state and federal government. So if we want to continue to get the grants to assist our community, we have to have all the documentation they require. So when you come in, please make sure you have a photo ID for anyone over 18 in the household. They also require a social security card, and we can make copies for you. If you're coming in, please bring a copy of your lease, and then we need household income for the last 30 days for the household members over 18. And this does include if you are collecting unemployment, Social Security, disability, TCA, any sort of income of the last 30 days. And then, of course, why you're there, your utility termination or your eviction notice. Evictions, COVID related, technically at this point cannot start until December 31st. However, that does require the tenant to file with the courts explaining their COVID situation, or their evictions will move forward. As I mentioned previously, CAC was very proactive with obtaining grants. As of today, we have 1.1 million awarded to us through a variety of sources, and that is for direct client assistance. There's no administration or salaries taken out of that money. And we have spent $338,131. So, and that was assisting 159 households or 493 people. It's very rare to be in our situation and have money to spend. Unfortunately, clients are not coming in. A lot of these grants only allow us to assist up to 6 months. So if your thought is you're just gonna run up your debt until the end of COVID, we're not gonna be able to help you. We can only go back 6 months. So please come in now. Let's get you back to even, and then we will see what the future brings. But if you come to us in March and expect us to be able to help with everything, that's simply not going to be the case. So this is a great situation for us to be in, to have this money for the community, but you have to come in to be able to utilize that. So please visit the website, call with any questions, come in, ask questions, but we want to keep everyone housed. With the cold weather coming, we don't want to see evictions happen. We don't want to see people get into a situation that when evictions can begin in December, that they have nowhere to go. Once you have an eviction on your record, it's very difficult to find a landlord to rent to you. So please be proactive and come in, and let's get your situation addressed to date, and then we'll move forward from there. Thank you.
So we are available for any questions at this point?
You talked about the difficulties, facing the difficulty with people in contact tracing. Can you talk a little bit more about what is unwilling to share, and if they said why they're unwilling to cooperate?
Some do and some don't. Basically, again, it goes back to pandemic fatigue. It goes back to individuals not wanting to, in essence, isolate in their homes again. Some of the individuals feel fine with this virus. We see a fair number of people who are asymptomatic could totally feel fine and question why they need to stay in. But it's critically important for anyone, regardless of whether you're not showing symptoms or having mild symptoms, to cooperate with the contact tracers when they call, to identify any individual that they've come in close contact with, and to also isolate themselves.
You mentioned the CDC website you go to, but other things on there that would really emphasize gatherings, because coming up, we got Thanksgiving, Christmas,
The biggest thing that I would emphasize is you have to be extremely careful with anyone that you don't live with. And it could be a relative, could be a cousin. It could be, your mother and father who potentially, live in a different state. if you aren't living with them currently on an ongoing basis, it still puts you at risk because you don't know what their exposures have been. So I would say that keeping your events small and keeping them to people that you know that are in your family unit that you live with, or that have been in some sort of bubble that you know and you trust what their exposures have been or haven't been.
Can you or Dr. George speak to the current testing result turnaround for COVID, especially people might try to use that as a value for the entire gathering?
I can speak to the company that we use for the testing that we do. It's typically around 48 hours. I believe Meredith is about sometimes less than a day.
So with regard to testing turnaround times, there had been some frustration and concerns early in the pandemic about longer wait times. We at Meritus have essentially set up a workflow in which all of the tests at our screening site on Meritus Medical Plaza North come back within 24 hours for all of our patients. And we additionally are looking at multiple options for rapid testing that can occur in under an hour that we can utilize in our emergency room, primarily for those most ill patients, so we can help direct them to the right place of care.
The testing at Emeritus Medical Plaza North, is that just for people with symptoms, or is it the same turnaround time for without symptoms?
Any patient in our community that wants a test can have a test done with the turnaround time under 24 hours regardless of symptoms.
And the wait time, just in terms of getting the line going up 81?
With regard to the wait time at the Meritus Medical Plaza North, we certainly encourage coming. We're seeing wait times under 40 minutes at present. There have been some bottlenecks in the past few months, and we've looked to expand this with additional staff members, streamlining the workflow, phone calls so that we can get you right up to the front, get a swab, and get you on your way.
You also mentioned there was some pretty seasonal places,
Mhm.
Emeritus, Smithsburg, and Hollywood, but then you mentioned COVID testing site at a certain
Mhm.
residential prison. So I'm just trying to figure out, are you testing the folks at there at Creighton for COVID as well as flu and cold, Smithsburg and Hollywood for flu and cold, and how's that separate?
The best way to have clarity for our multiple sites is to visit meritushealth.com, and we have clear explanations of the hours and the days that there are access provided for any patient in the community. And to be clear, we continue to have our drive-through screening at Creighton Boulevard. And also at Creighton Boulevard is a seasonal illness care clinic, which is that place to go if you're not in an emergency, but you have some symptoms that could be COVID. That's a cough, a fever, shortness of breath, sore throat, and you're just not sure, and you want to be evaluated by a physician.
Those are already up?
Yes, so the Creighton Boulevard site is up and running, as is an office in Smithsburg, and we plan for next month having an additional site at Robinwood.
Senator mentioned there was some upticks recently, some metrics.
Yes.
You went over a lot of metrics. Is there a couple in particular?
Just what I went over. Our positivity rate has become unstable, as well as our case average. We've had some outbreaks and some clusters in the community, but that have obviously affected that. But for the most part, we're continuing to see community spread related to gatherings. It's kind of simple as that. People are gathering and they're not taking the appropriate precautions. And I mean, from large gatherings all the way down to family birthday parties.
Is there any advice you can have with Dr. George about if people are going to get tested? What kind of advice they get tested and then going to a party or something like that as part of the time?
Well, in the in between time, they need to stay at home.
Or if they're sick, I mean,
If anyone is sick, first and foremost, if anyone is sick, they need to stay home. If anyone has a need to go get testing or feel as though they need to go get testing, they obviously need to do that, but they also still need to isolate themselves at home until they get their results. I don't know if you have anything else you want.
if you don't have symptoms
Mm-hmm.
and you want to go somewhere and you're getting tested, then there's sort of like you might be sick and you may not know it because you don't have symptoms. Is it like 2 weeks for incubation time?
There's up to 2 weeks, yes. Yes. Okay? Thank you, guys. We appreciate it.